बिस्मिल्लाहिर्रहमानिर्रहीम। सर्वाइकल कैंसर सिम्टम्स, कॉजेज़, टाइप्स एंड टेस्ट। ख़वातीन में बच्चेदानी का कैंसर, इसकी अलामतें, वजूहात और इसका इलाज। दिस पिक्चर इज़ शोइंग सर्वाइकल कैंसर, यूट्रस, एंडोमेट्रियम एंड वजाइना। Cervical cancer definition is the uncontrollable growth and spread of abnormal cells in the cervix. Human papilloma virus HPV type 16 and 18 have been found to cause 70% of cervical cancer cases. 10,000 new cases of cervical cancer every year. हर साल ये 10,000 नए केसेस रिपोर्ट होते हैं। Symptoms of cervical cancer: vaginal bleeding between periods or after menopause, menstrual bleeding that is longer than usual, bleeding after intercourse, pain during sexual intercourse, persistent pelvic or back pain, pain during urination, needing to urinate more often, vaginal discharge that may be heavy or have a foul odor, weight loss. These are the symptoms of cervical cancer. Signs of cervical cancer at advanced stages: irregular vaginal bleeding, increased vaginal discharge, pain during sex, longer and heavier periods, unexplained and persistent, weight loss. Causes of cervical cancer: smoking, weak immunity, multiple sexual contacts, early or multiple pregnancies. Risk factor for cervical cancer: unsafe sexual practices, smoking, weakened immunity, contraceptive overuse. Cervical cancer diagnosis: pap smear, HPV testing, punch biopsy, endocervical curettage, cone biopsy and LEAP. These are the tests to diagnose cervical cancer. Prevention of cervical cancer: multiple sexual partners, smoking, oral contraceptives and sexually transmitted diseases. इससे हमें बचना चाहिए. 1 dose of HPV vaccine. Cervical screening every 5 years. This is the vaccination of cervical cancer. HPV vaccine of first dose. Cervical cancer stages: first stage, cancer is small and has no spread to the other parts. Second stage, cancer has grown and may spread to the lymph nodes. Third stage, cancer has spread to the lower parts of vagina or pelvis. Cancer may be spread beyond pelvis or other organism. These are the 4 stages of cervical cancer. Histopathological types of cervical cancer: squamous cell carcinoma 71% of cervical cancer, keratinizing, non-keratinizing and verrucous. Adenocarcinoma 25%, clear cell and endometrioid. Adenosquamous carcinoma is 4%, adenoid small. Possible treatment for cervical cancer: surgery, radiation, targeted therapy, immunotherapy and chemotherapy. 5 पॉसिबल ट्रीटमेंट्स, इसमें सर्जरी भी है, शुआएँ भी लगाई जाती हैं और मेडिसिन भी दी जाती हैं। इम्यूनोथेरेपी में वैक्सीनेशन है, कीमोथेरेपी में शुआएँ होती हैं। हाउ टू रिकवर फ्रॉम सर्वाइकल कैंसर ट्रीटमेंट: जब सर्वाइकल कैंसर की ट्रीटमेंट हो जाती है तो उससे हम ट्रीटमेंट से कैसे रिकवर करते हैं? प्रैक्टिस रिहैबिलिटेशन एक्सरसाइजेज, टेक एडिक्वेट रेस्ट, कंसिडर डाइटरी चेंजेस, सीक इमोशनल सपोर्ट एंड मैनेज पेन. लाइक, सब्सक्राइब